talking for the people in the Health Innovation School in Brabant. And we also have a lot of people who already followed the Health Innovation School and heard your talk about old and new power, like already in 2017, and who are really enthusiastic to hear you again. So that's why we also have a live stream. And I think that your experience, but also your energy and creativity really has inspired already a lot of people who followed Health Innovation School. And at the end, we will have 5 to 10 minutes for some extra questions from the chat. And so when I will be strict around 1:20, it is because of the time. And thanks so much. And we're very happy to have you here in the Netherlands in a digital way.
Oh, Karen, thank you so much. And, you know, I think what's happening with the school is incredible. And the way, you know, it's spreading and the kinds of topics that you're working on are so interesting and important. So I'm absolutely delighted to just even be in your lives for 45 minutes. So I am going to talk about a social movement for healthy change. And when I talk about healthy change, I mean, how do we make change happen healthily? And, you know, very often the way that we go about change and trying to make it happen in the health and care system is we push it down on people, you know, and there is a lot of resistance, and change is not a good experience for people. So how can we create change where people are really positive? And again, it's just really interesting listening to some of you know, to some people talking about their projects and how enthusiastic and how much energy they have for those projects. So why couldn't we do change across the system in a way that is healthy, you know, that isn't that doesn't make us feel bad or affect our health and well-being? Okay, how can we create change that we feel really good about? So you know, when we think about a social movement, you know, what do we mean? So you know, when we talk about social change, you know, wanting to bring about change across our whole system, okay, wanting to have a health and healthcare system that is more equitable, okay, having a health and healthcare system that is safe, that gives everybody a good experience, okay, you know, so actually maybe thinking about this in a social movement way is a good way, because it's a word that suggests lots of people walking together, like leaving behind the old way of doing things and traveling towards another. So what I wanted to do is to just share with you some of my ideas and thinking, and some of it some of you know from before, and some of it is new. So I work in a team that's part of the National Health Service in England that's called the Horizons team. And I am an internal change agent. So, you know, I work inside the system, helping to make change happen. And we are a very small team. There are 20 of us. We work at a national level across the National Health Service in England, but we have a special job. So the first thing we do is we help people to own what they create. And much of our work is about creating spaces, okay, virtual spaces and face-to-face spaces where people with a lot of different views and experiences can come together and create a different future. So since COVID has happened, we have run 120 big virtual spaces with an average of 585 people. That's the average. So some of the virtual spaces that we create have 1,000 people or more in them at any one time. The second thing we do is we understand that real change takes place in real work. So, you know, we work with people who deliver care, doctors, nurses, therapists, support workers, and patients and people that experience care, okay, experts by experience, to learn together to create action and change. The third thing we do is we help build power. We help people who deliver care and people who have care to build their own power to make a difference. And the final thing we do is, as a team, we connect the system to more of itself. So we work with thousands of people across the health and care system through communities and networks and social media so that people will connect. And since the pandemic happened, our little team of 20 people, we have been working to support areas of big priority. So we've been working on the health and well-being of our NHS people. So in the NHS in England, we employ 1.3 million people. And how do we help people to, you know, these people that are delivering health? How do we help them to stay well and healthy? We've been working on COVID testing and how do we scale up innovation in COVID testing. We have been working on innovations in patient pathways and new ways of doing things. Currently, we're working on the delivery, getting organised for the delivery of COVID vaccines, and again, bringing many people together, okay, to work together on change. So that's what I do. And how can I give a talk to the Innovation School without talking about old power and new power? And in terms of the Horizons team, it's one of the key ways of thinking for us, because we work in a health and care system that is based on old power principles. So, you know, currency, money, you know, how do we compare it to formal authority? So a few people at the top of the system have the power, like a few people have money and most people don't. And they will push it down in the system, the power, and will command people to do things. You have to do that because it's the quality standard, or you have to do that because it's the rules, or you have to do that because you know, it's the target. And old power is closed. So if I am a leader of a hospital system, say in Amsterdam, and I work with the local community, I can't command them to do anything. And old power is largely about transactions. It's about structures and systems and processes and holding people to account. And it's very hard often to be an innovator in an old power system. So we also need to think about new power. And new power is like a current, it's like energy. When many people who want to achieve the same outcomes, okay, come together, it's like a social movement, you know. And I'd say when we work in new power ways and we do it well, I think it's a much healthier way to do change, because anybody that wants to be part of the change can come and be part of it. We can pull people in. We are sharing, it's open. And new power, okay, when we are building a movement or a campaign for change, it's based on relationships. One of the big differences between old power and new power is that people will engage in new power change because they want to, because it fits with who they are in the world and the things that they are passionate about. But when we're doing change in an old power way, we kind of have to accept the change because it's happening through structures. So when we are innovators, okay, we have to be able to work with both, because we're working in an old power system and we want to work in new power ways. So to me, the people who are most successful at implementing innovation are the people that are able to work in the zigzaggy place in the middle of the system. You know, we have to be able to work with both. It's so interesting what is happening with COVID, you know, and what is happening to power in the system. Because people think, oh, you know, it's command and control and it's old power, you know, but actually the reality is we're seeing more and more new power practice. You know, we can talk about metaphors, and a metaphor means that we take two things and we compare them. So many of the metaphors that we're seeing around COVID are old power metaphors. So we see these again here on the left-hand side. You know, we talk about the war, the fight, the battle against COVID-19. A lot of the metaphors are about crime. You know, we talk about lockdown, curfew. On social media, we talk about COVIDiots, who are people that, you know, COVIDiots are people that don't wear masks or, have parties. And transgressors. You know, we talk about doctors and nurses being superheroes. Lots of our doctors and nurses hate being called superheroes or heroes at all, because they say, you know, when you have a metaphor of superheroes, it means that the system is terrible, and we are flying in and sorting it out, and our world isn't like that at all. But we also talk about our clinicians being troops in battle. We talk about the front line. We talk about battening down. And these are all metaphors, old power metaphors that are about command and control and top-down leadership. What we're also seeing increasingly are many new power metaphors around COVID. A journey with challenges, yes, but we should be hopeful about the destination. We talk about human actions that are positive based on a shared purpose that we could all be part of, building, forging, reconstructing together. You know, many people working together with a shared purpose, each playing their part. And, you know, a term that we use in England is about being interdependent. I think that's such a great term, because interdependent means, you know, I have to be independent because I've got a job to do and I've got my own goals that I have to achieve. But I can only do that by being dependent on other people that need to play their part as well. So it's interdependent on each other. And it's about healthy change, you know, creating communities that are resilient and connected. So, you know, when we think about this, and we think about, how do we create a world? How do we do healthy change? And at the heart of this, I think, is a design dilemma. And we see this everywhere in terms of innovation and improvement. So my background is as a social scientist, okay? And the first thing when you go to undergraduate school in social science that you learn is the dilemma between structure and agency. And when we talk about structure, we think, how do we make change happen? So if I've got an innovation that I want to implement, how do I make it happen? Do I change the structures and systems? Do I have targets and performance goals? Do I have compliance where I say to people, you have to do this, or regulation? Okay. Do I create new policies? Do I have a program management system or incentive system? Or do I work with agency? Okay. Let's talk about this word agency. Agency means the power to make a positive difference, okay, both individually and collectively. Okay. Sometimes it's a very hard word for people for whom English is not their first language. But, you know, we talk about being a change agent. So agency is this power that we build. And it's about, to what extent do I feel that I can actually make change happen? And to what extent do I feel that on my own? Or to what extent do I work with others? So when we talk about agency, okay, social movements are built on agency. It's about activating people. It's about our ability and freedom to make choices. It's about collective action. Leaders everywhere, that we can all be leaders, okay, not just people who've got formal jobs. It's about social action, solidarity, and social movements. Okay, if you look at the health system, okay, and how change has happened in the last 30 years, the last 3 decades, okay, we've been trying to make change happen through structure. Okay, we keep changing the rules, we change the incentives, okay, we change the structure and the organization. Okay, that's been the way that we've been doing things. What we're seeing more and more now, it was happening before COVID, but it's happening even more, is we focus on agency, okay, enabling people to come together and make a difference. And what we've seen through COVID is a big shift towards a focus on agency. Okay, here's an example of building agency. One of the teams that we work with in Sweden, in Jönköping in the south of Sweden, they've set up a living library. So when we think about a library, normally you'd think about books. And if we want to learn and we want to build our knowledge, we borrow a book. Okay, the living library is based on the same principle, except who you learn from and who you borrow is a group of patient leaders, people with lived experience. And as has been happening in the Netherlands, as has been happening in Britain, one of the things that we've seen is a big shift towards digital consultation. So people having a meeting with their doctor or their nurse or their physiotherapist virtually. But very often in our countries, what we do is we change the system and we train the doctor or the nurse or the physiotherapist to work in the new way, but we don't train the patient. And what's happened in Jönköping, the living library, this group of patient leaders have been training and supporting thousands of other patients to shift over to virtual consultation. Okay, that's agency. So it's about building the individual agency of the people who are the patients who are having a virtual consultation, and it's also about collective agency by creating this living library group. And sometimes we say, well, that's okay, but I'm just a nurse, or I'm just a doctor, or I'm just a manager. I'm not at the top of the system in old power ways. What difference can I make? Actually, so many studies, they show us, like this one does. This is called the Network Secrets of Great Change Agents. What they show us is when it comes to being a change agent, being somebody that can make change happen, actually being at the heart of the informal system of change is far more important than being a senior leader in terms of my ability to make change happen. And that's because healthy change is based on relationships. And the people that work in new power ways, okay, at the heart of the system, okay, because they work in ways that are based on relationships, it's much easier for them to make change happen and influence other people for change than the people at the top of the system that try and push change down. There's so many studies that show this. This is from Leandro Herrero, who writes about viral change. And he says people who work in new power ways, who are highly connected, okay, who have informal power, have got twice as much power to influence change as people with hierarchical power. Okay, so if we're going to work in that way, okay, if as health innovators, we want to work with informal influence, we have to find the most influential people. So this comes from an organization that my team, Horizons, works with a lot. It's a Danish organization called Innovisor. And they have done analysis, and they've worked with hundreds of organisations in many different sectors. And what they find is that in an organisation or system, there is typically just 3% of people who can influence, who are influencing 85% of the other people. So this small number of people are, we call them super connectors. You know, they're the informal influencers. You know, they are these people on the bottom right-hand side, you know, that are influencing in new power ways. Okay, what we can see is that these influencers are driving conversations with 85% of the other people. So, you know, if I want to, if as an innovator, I want to influence other people in the system to take up my my innovation, it's really important that I work with these super connectors. And why are they important? Because, you know, when change fails, okay, when innovation fails to spread, okay, why does it happen? Lots of reasons it happens, but one of the key reasons is because the people that are trying to spread the innovation, or the people that are trying to make the change happen, they don't have a good dialogue with the informal system, because their mindset, okay, the way they think is an old power way. And the reality is that the people that make or break change are the informal leaders. And, you know, these super connectors are the people that have got the relationships, the networks, they know the content, they know the organization. And these informal leaders are driving the perceptions of other people. Okay. And when there's something new happening, like we've got a new policy around how we recruit people, okay, or how we pay people. What will happen is the people in our organizations will go to these super connectors, these informal influencers, for advice. And these are the people that make sense of things, and they reduce ambiguity for other people. And what happens is that these super connectors are trusted by their peers, by other people, far more than formal leaders are trusted. And very often the formal leaders, because they're so focused on old power relationships, they don't even know who these people are. And at a time like the pandemic, like we are now, it's even more important that we understand who these people are. This also happens in social media. You know, it's the same proportion. Globally in health and healthcare, 85% of the content that gets retweeted comes from just 3.3% of people who tweet. And, you know, if we want to be influencers, yes, we can be influencers in our own organizations and systems, and that's great. But we also need to think about how we can influence more broadly. You know, we should never underestimate the power of social as a source of information to drive change. And if we want to be leading a social movement of healthy change, we need to be in this space. If you look on the left-hand side here, this is from an oncologist, okay, Joseph Flaherty, and he says, since COVID happened, I get more of my clinical information from Twitter than any other source. And the right-hand side here is a project, it's a crowdsourcing innovation project that my team worked on. And this was a project across England, okay, to find innovative solutions to enable us to scale COVID testing. And we worked with, you know, people in the public sector laboratories, and we worked with people in the private sector laboratories. But 20% of the traffic, 20% of the ideas came directly through social media. So, you know, if we want to innovate, if we want ideas, we need to be there. And these people that are the social media super connectors are even more important at times of ambiguity and uncertainty. And I brought you 3 of the most influential super connectors, are 3% people, okay, from the National Health Service in England. On the left here, we have David Morgan, and David is a paramedic. but he is so influential. Okay, and if I want to spread some news to all the paramedics across England, probably the most effective thing I could do is ask David Morgan to spread it for me, because he has so many connections with so many people. The person in the middle, the Twitter account in the middle, is Trisha Greenhoe, and Trish is she's a family doctor, family physician, and she is a professor of general practice at Oxford University. And right from the beginning, she has run a campaign for wearing masks and face coverings for COVID. And she's probably done more and been more influential in promoting masks and face coverings than any other person. And it's interesting, this photo, this man in this photo in the middle here, is called Ed Davey, and he just got made the leader of one of our main political parties, the Liberal Democrats. So he went for a photo opportunity in a cafe, and he only wore a shield, not a mask. And she said, you know, what she says here is, if you see somebody waiting on you wearing a shield, actually they're dangerous, because they're giving you their breath with germs, you know, with virus on it, straight down onto you. Okay, so if you see a server like this, tell them they've got to wear a proper mask. And on the right hand side, we have Rachel Clark, and her Twitter handle is @Dr Oxford. She's a end of life doctor, okay, who used to be a journalist, who really understands how to communicate. And she's amazing. Like, any topic or campaign that she gets involved in, she can bring, you know, 100,000 people to that topic. So how do you find your super connectors? Well, you can bring in a company that can do organizational network analysis for you, or you can find out yourself. And the quickest way to find out is just go and ask people. You know, just ask people. When you've got concerns at work, who do you go to ask for information? Or whose advice do you trust and respect? And I reckon it takes about 10 people. Once you've asked 10 people and got their answers, you know who your super connectors are. So what does it mean for me? Well, as an innovator, you know, all of us should aspire to be super connectors. And even if we can't be one, kind of moving in that direction is very helpful. So to put a lot of innovation, put a lot of effort and energy, not just into our innovations, but building our connections and relationships. And one of the things about working in a new power way, okay, doing healthy change, is every one of us has to be a model in how we behave, particularly around trust. And if we're innovating and we involve a group of people and we say that we're going to do something as a result, we must always follow up. Okay, not all of us can be super connectors, but you know, if we want to do healthy change and we want our innovation to fly, our super connectors are our most powerful allies. So we want to get their insights, we want to engage them in change, we want to stay connected with them for the long haul. And we, you know, a relationship with a super connector isn't a one-off or a short-term relationship. A relationship with a super connector is for the long term. And you know, when we're senior leaders, we may be less influential than we think, because if we want to get the same level of influence in old power ways by doing top-down change and cascading it, okay, if we want to get the same level of influence that these 3% of people at the heart of the informal system get, we need 4 times more people to do it. So, nearly finished, okay? You know, we talk about, we need, as innovators who want to do healthy change, we need to build our change agency. And we can build our individual agency or our collective. And just the final thing I wanted to say is 10 ways to do it. Okay, number 1, create small change 1 step at a time. Sometimes we underestimate how important really small changes are. Okay, to just test a change that does, you know, that affects 2 people or 2 patients. Okay, we cross a bridge from something we talk about or a concept to something that's real. Okay. Number 2, emphasize progress. You know, if we want people to engage, show that it's making a difference. Number 3, reframe our thinking. So instead of saying that failed, it's a learning opportunity. Instead of saying I'm uncertain, I'm curious. Number 4, find your crew. You know, a group of people who can be your own social movement, okay, who want the same things you want. Number 5, get social support, because you can't be a great change agent on your own. You know, however clever or creative or innovative you are, you're working in a system that doesn't like challenge to the status quo. Okay, so you have to find other people to be in your movement. Number 6, make change routine. And that is why, you know, I have got so much respect for the Health Innovation School and for organisations that have a quality improvement methodology or a change methodology, you know, that are trying to make change and innovation and improvement happen all the time. Okay. Number 7, learn from the best. So if you're trying to make a change happen, like you're trying to, you know, you want to transform primary care, who are the people in the world that have done the best transformation work in primary care? You know, reach out to them and ask them. The worst thing that can happen is that they can say no, no big deal. And they might say yes. Number 8, think story. So, you know, if we want to, again, we want to engage people in our change, if we want to do healthy change, okay, tell our own stories. Say, you know, why is this important to me based on my own story? Number 9, build a spectrum of allies. Often when we're innovators, okay, we have a comfort zone, which is, you know, we mix with other innovators, okay, and we end up with an echo chamber of just people that think the same as us. So how do we find people who currently aren't our allies or don't necessarily want the same thing and bring them on board with what we're doing? And finally, number 10, persist. We did a study in the National Health Service in England of a qualitative study of clinical innovators. And they were a very broad range of people. Okay, the thing that these 10 innovators had, these 10 clinical leaders who had delivered innovation had in common, the core thing they had in common was their resilience and their ability to keep going for a long time, even when, you know, other people questioned what they were doing or ridiculed them. So maybe the last thing to say to this fantastic group of innovators I'm with now, okay, is to end by quoting Gandhi. Okay, so first they ignore you, then they laugh at you, then they fight you, then you win. So, you know, we can all be part of and build this movement for healthy change. There's lots that we can do to build our agency, okay? And one of the most powerful things that we can do is find our super connectors. And then at the end of the day, we just have to keep going. And I think I'll stop there.
Thank you so much, Helen. I think even now with COVID, your this story and the way we see that change is needed in the world, in different perspectives, from healthcare to the economic perspective. Can we thrive towards other economies? Like Kate Warward is also giving examples of. I think it's such an inspirational, but also the last slide had 10 ways to build your own change agency. I think it would be nice to have a talk with the group on this, because we know there are 50 different participants. And I think it would be nice to hear some perspective of the way the participants, the different people working in different organizations in Brabant or in the Netherlands, how are they looking towards the old power and the new power? How do they see the difference in their day-to-day work?
Yeah, Karen, shall I put the slide back up? Is that helpful then?
Yeah, I think it's helpful, because maybe the old power and the new power, because I think that's really the starting point. Because if you know where there is old power and there's new power, you can see where you can be able to have a bridge, to build bridges, and where there is where you get stuck in the system, where you're kind of a lonely a lonely person stuck in an old power system if you have no other new power help? Is there somebody who recognizes a lot of old power in the healthcare, in the broad sense, or in their work, old power ways of working? Somebody who wants to tell a little bit about the old power in their day-to-day work.
Yeah, tell your story. I'd love to hear.
Somebody who wants to...
Yeah.
Yes, please go ahead.
Yes. From the study, we're with the family doctor, seeing how that that they won't have enough staff in the near future. The system in the Netherlands is organized with a lot of old power ways, because if you want to go to a hospital to see a specialist, you have to go through the family doctor. He has to write a note so that you can go to the specialist in the hospital. That is why we are looking to empower the patient or the citizen so that he or she can find alternative ways to help themselves, so they don't have to go into the system to find the proper help.
Yeah. Yeah. Really.
I think.
Yeah.
Please go ahead, Helen.
Yeah, in our system in England, one of the biggest changes that we're seeing in primary care is a system called social prescribing, and it's making a really big difference. And we have it's a very big innovation. So we have people who are from the community, so they know the community, that get employed in primary care, as part of the primary care team, and so many people that come to visit GPs in England are coming because they have housing problems, or they have money problems, or they're alone, or actually they need exercise. So the family doctor will refer them. Will refer those people to the social prescriber, and the social prescriber is somebody who's trained but from the local community, that can prescribe all kinds. They can prescribe exercise. They can help them with money. They can help them with housing. It started off in one or two places, but now it's everywhere.
Yeah, it's good. I think in the Netherlands this is called welzijn op recept. For the ones who know it, bij welzijn op recept kan de arts, het is nog wel de arts, we hebben nog geen there are not yet social workers working in primary care, but instead of prescribing medicine, Helen, they give enough receipt for, and that's also an intervention which is getting more common in the Netherlands, also with the focus on the positive health. Looking at the broad side of health, and not only looking and focusing on the diseases. We've got also a question coming in from the YouTube live stream, and this is the one: if you were a super connector, or you have the feeling you're a super connector, but you won't be taken seriously by the decision makers. So actually, in the last slide, you said that, like Gandhi told us, ignore you or laugh at you, but you're not taken seriously. What's your suggestion for a super connector or innovator, what to do next?
So very often, if you are a super connector and you've got lots of connections and relationships, you can just make change happen, because you can you can influence people around you. So what I'd say is it's really important that I think, particularly innovators are you're finding the people to work with and around you first. And I think too often, we come up with an innovation and we go straight to the senior leaders and say, will you support my innovation? I think what the studies show is that if actually we come up with an innovation, but we first build a group of people that support the innovation and are trying parts of it out, and you've actually got a wider community of people in support of the innovation, it's far more likely to happen. And I think sometimes we go to the senior leadership too early. I think if we can build time and time again with change, we see that if we can actually build a group of people around us that support the change as well, and if we can actually behave more in a new power kind of social movement way, I think it's much more likely to happen. And that's how I feel as a change agent. If I spent all my time going to senior leaders and asking them to do things, I would never achieve anything. Hardly, because it's much better and it's much healthier as an innovator to build your community around you and get people trying things out and advocating for the change, so that when you finally go to the leadership, you actually got a lot of people that want this to happen and not just a few.
Yeah. A really valuable answer, because take the group as a super connector. You should be connecting first without going to the top, the senior management too fast. Yeah. Some other, I think it is not a question, but one comment in the chat is also, aren't we the super connectors in a way? And that was from Caroline. And Caroline, I think, if that's, I don't know if it's a rhetorical question, but I think the fact that the participants in the Health Innovation School are willing to invest their energy in a project, in learning something new, makes the fact that you are super connectors. And then Joost Boerekamp asked, what is the value of old power in relationship with new power?
Yeah, that's a very good question. And I'd say it's very important not to make a judgment about old power and new power. We're not saying new power's great and old power's terrible. What we're saying is we're living in a system where the two are in tension with each other. And when you think about, the health and care system, I think that I can't see ever a time when we don't have old power in some way. It's like hierarchy, I don't think that hierarchy is a bad thing. Okay, I think what people do with it is often a bad thing, like use it to create silos. But if we're the kind of leaders, maybe like people in the school are, where you're making connections across, across barriers, then it can be a very good thing. So as innovators and change agents, we have to be able to work with both. And I see a lot of people, particularly clinical innovators, who don't know how to work with the old power system. So they just work in new power ways. And like we have a saying in England, which is called 1,000 flowers blooming. And that's not a good saying. It basically means we're doing lots of bits of change all over the place, but all the little bits don't add up to become a big change. And I think often if you want to create a really big change, then you have to work with the old power system. I mean, look at the American Civil Rights Movement. The American Civil Rights Movement didn't succeed just because it worked in new power ways by mobilizing millions of oppressed African Americans. The American Civil Rights Movement succeeded because it was able to influence the formal system, and change the law and get the media on board. so all of us, you know, have to be able to work with both. Yeah,
yes.
maybe we're the bridge builders between the old and new. That's Eric. That's a really good way of putting it. As innovators, and particularly if we're innovators that want to make healthy change happen, that's exactly what we have to be.
Yes, we have to make and building, keep on building bridges. One last question, and then we're going to have a big applause for you. One last question from the YouTube live stream is about the board potential for a superconnector. Can you be also part of the board as a superconnector? Because we also see upcoming organizations. Not all organizations or all board members are typical old power. Yeah. How do you look towards that shift in leadership towards the future? And what do you see happening?
Yeah, so again, another great point. What the data shows, okay, is that you can be a board leader and be a superconnector, but most of them aren't. So what the data shows us is if you look at how much change is driven by senior leaders, okay, you're talking about roughly 12% of people, okay, have a seniorish role, and they drive 55% of change. Okay, so 12% are driving 55% of change, but the superconnectors are 3%, and they're driving 85% of the change conversation. Okay, so actually, if you're a board leader, so you've got the formal authority and you can work in highly relational new power ways, then you're in a very, very good place to do healthy change. And I would say, when I think about the leaders in my system, you know, the senior leaders that I really admire and who inspire me, they are those kinds of leaders. You know, they are the leaders with the old power or authority, but they work in very relational ways.
Thank you so much. I think that's a really good perspective for the future, for the ones who are following the Health Innovation School, but also to keep us inspired and ambitious to change the world into a new power, while not having a judgment about the old power. Helen, we're going to have a small break before welcoming Zena Kayat. Mensen, zet allemaal even op unmute. Dan kunnen we toch gewoon even ouderwets applaudisseren. Dus even die knopjes. We'd like to give you applause. Thank you so much.
Hey. Thank you.
That's great. That's very nice virtual applause. Thank you. That's the best virtual applause I've had. So thank you.
Have a good afternoon in England.
Yeah.
And,
yes.
See you again next year.
Yeah. Bye. Thank you, Karen. And bye, everybody. Bye.
Thank you. Bye-bye. We hebben pauze nu, toch?
Het is pauze en Zena die is vroeg opgestaan in Toronto. En Zena die verwelkomen we om 40, dus 10:10.